Good day, everyone. Welcome to Amana Healthcare. For the next presentation, we will be discussing about basic infection control practices in Amana Healthcare. So sit tight, listen, and enjoy the presentation. The contents of the presentation today will be divided into two main parts: standard precautions and transmission-based precautions. When we say standard precautions, it means that these are the minimum infection control practices that apply to all patients. Main components are hand hygiene, respiratory hygiene, PPEs, environmental care, and safe injection practices. On the other hand, transmission-based precautions are practices in addition to standard precautions that are applied to patients with known or suspected infections. There are three main transmission-based precautions in Amana Healthcare: contact, droplet, and airborne precautions. Let's now go to the first component of your standard precautions. Hand hygiene is considered as the most important measure to avoid the transmission of harmful germs and to prevent healthcare-associated infections. Hand hygiene can be performed either through the use of soap and water or alcohol-based hand rub. Either of the two are very effective in preventing the transmission of microorganisms. Good hand hygiene practices reduce the risk of things like flu, food poisoning, or hospital-acquired infections. So when should we be washing our hands? Ideally, we should be washing our hands as frequent as possible. In the hospital setting, we have 5 important moments that we should remember when to wash our hands: before touching a patient, after touching a patient, before any aseptic or clean procedure, after exposure to blood and body fluids, and after touching a patient's environment. Remember, hand washing is a simple yet very effective method in preventing diseases not only in hospitals, but also in our homes and communities. So stay safe and wash your hands.